we see that Black African Americans are 2 times more likely to develop the disease, and Latinos are about 1.5 times more likely to develop the disease than white older adults. And the sort of the underlying reasons for these disparities are in common with rural communities, in that oftentimes what we are seeing is that the underlying drivers of Alzheimer's disease are associated with risk factors like heart disease and hypertension and diabetes, which we also find to be higher in these communities. And when you look at the basis of all that, a lot of that is what I spoke to earlier, the structural inequities. If you're living in communities that don't make it easy for you to exercise or eat well or feel safe because of violence, or you're not socially connected because there isn't a network to enable that, these are what we call the underlying social drivers of disease. And as a clinician who takes care of patients who are hospitalized, I see the very end of that. But when you look upstream, you recognize that it's the structural setups of our societies. And that's where public health is really working towards, is how do we get at the underlying drivers of health, not just telling people eat well and exercise, but how do you build communities and economic structures that enable people to live safely, eat well, be active. So those are one main of
Right.
the main drivers of the inequities we see, whether it be racial, ethnic, or geographic disparities that we see in the rural areas.